Use any ATM of your convenience and stand a chance to win gold sovereigns.
In Sri Lanka, cancer and blood-related disorders have become a major contributor to both morbidity and mortality rates. In 2022 alone, 33,243 cases were reported, out of which 1,001, accounting for 3% of total cases, were leukemia, a cancer found in blood and bone marrow caused by the rapid production of abnormal white blood cells. What is devastating is that 790 lives of the patients treated for leukemia did not have a long lives.
These leukemias and lymphomas are more common in children than in adults. If you take children up to 14 years of age, there are about 1,032 cases reported in 2021 alone. So out of this, about 35% of children have been diagnosed with leukemia. And if you take adults from 15 to 35 years of age, about 15% of them have been diagnosed with leukemia.
About 4,000 new patients are diagnosed with blood-related disorders in Sri Lanka every year. According to the Health Promotion Bureau, approximately 2,000 children are diagnosed with thalassemia annually. Stem cell transplants can be used to treat around 80 blood disorders, including leukemia, thalassemia, and lymphoma.
Usually, the main mode of treatment or main modality of treatment is chemotherapy. However, there are certain groups of leukemias due to certain mutations that occur genetically cannot be treated alone with chemotherapy. So chemotherapy will not suffice to eradicate or destroy the cells from the body. So in those cases, we might need an additional help. That is when we need allogenic stem cell transplantation.
Stem cells are the only cells in human body that make different cell types like blood, bone and muscle cells. Stem cell transplants are generally of two types, autologous and allogenic. Autologous transplants are conducted using the stem cells of the patient themselves, whereas in allogenic transplants, stem cells of a donor are used to replace the damaged blood cells of the recipient. At present, stem cells have become an essential treatment for blood cancer and blood disorders.
There are about over 90 registries at the moment in the world, and over 42 million donors are registered under those registries. About 10 to 20% of number of donors are increasing yearly in all over the world as a registered stem cell donor. But unfortunately, we don't have a registry in Sri Lanka. Whenever there is a necessity to identify a stem cell donor for one of our patients, we have to look into the registries of the other countries. Very unfortunately, it's quite difficult to get a matched donor from the other country because the HLA diversity is so huge that matched donor may not be able to identify from other registries due to HLA disparity between the donor and the patient. Even if you find a matched donor from the other country, it will cost over 5 million to get down the cells to Sri Lanka for transplantation. Therefore, the patient has to bear large amount of money to get down the stem cells from overseas.
Stem cell treatments are available in developed countries including the United Kingdom, Germany, Japan, South Korea and Singapore. Neighboring India, which has emerged as a global hub for medical tourism, has also become an attractive destination for stem cell therapy. Although in Sri Lanka, facilities are available for such treatment, the most pressing issue remains the lack of matching donors, or for that matter, registry containing information of potential donors.
We are doing stem cell transplantation in some places in our public institutions. In 2016, Maharagama Apeksha Hospital started their program, and then 2021 from Lady Redway Hospital, and then recently about 2 months before, the transplant unit established in Teaching Hospital Jaffna. Those 2-3 places currently that function in doing the stem cell transplant, especially the autologous stem cell transplant. But within the family and some disease conditions, we should do allogenic stem cell transplantation. From allogenic stem cell transplantation, donor and the patient should match their HLA type. If not matched, donor cells are not destroyed by the patient's immune system. Donors, about 25% of the patients get the relative from their family. Other 75% of them don't have related donors to get their transplantation, and then they die.
In a nationwide effort to seek suitable donors for patients diagnosed with blood disorders, the National Blood Transfusion Service launched Sri Lanka's first stem cell donor registry in June this year. This will allow patients with blood disorders access to a database of volunteers willing to donate stem cells, providing them with a second chance at life. After donation, the donor stem cells naturally regenerate and return to normal levels on their own.
One might think that up to now that we don't have this facility, but we do have bone marrow transplantation opportunity in Sri Lanka, but in very limited quantities. 8 patients maximum can have a bone marrow transplantation in Sri Lanka. That is due to many limitations. The most critical limitation is they couldn't find a matching donor for the treatment requirement. So that is the main reason we should have a good donor registry to find an adequate number of donors registered in the list through which that will be able to find a match for the needy patient. That is the crucial thing that we launched this bone marrow transplant donor registry.
According to the bone marrow transplantation program of the National Cancer Institute of Sri Lanka, the success rate of stem cell transplants in Sri Lanka is 90%. Against such a backdrop, TV Derana, in light of the 19th anniversary, launched the national initiative Prana to register donors to Sri Lanka's first stem cell donor registry in collaboration with the Ministry of Health, the National Blood Transfusion Service and the Sri Lanka College of National Transfusion Physicians. We had a name when established in Derana, which was to distance ourselves from personal agendas and provide a service to the public. That is what Derana has been doing for the past 19 years. We stood on behalf of Sri Lanka and its people. When the anniversary was drawing closer, we thought we should do another program. That is what we commenced as Prana.
අපි තවත් වැදගත් වැඩක් කරන්න ඕන කියලා තමයි ප්‍රාණ නමින් මේ වැඩසටහන ආරම්භ කරනවා.
A hotline was dedicated to the public to register as donors.
We should not wait for government organizations to start initiatives also to be of service to the less privileged people of our country. And I know some individuals attend programs of this nature considering that it's a social obligation or using their celebrity status to create that awareness. But I urge even those celebrities to come wholeheartedly to support this cause, not only to appear and disappear, but to be part of some of these worthy causes. I think it's important that we show our support towards the fellow citizens of our country.
I would like to ask all the Sri Lankans to support this cause. And I know that being a Sri Lankan and whole nation, when it comes to difficult tasks, people are get together, people are supporting each other. So I'm sure that people of Sri Lanka will help this great cause.
Potential donors should be between the ages of 18 and 45 with a weight of 50 kilograms or above and meet the required medical stability. Those who have fulfilled the basic requirements can fill out a pledge form, be available for a quick swab test for the collection of sample cells and then be added to the registry. When there is a match, the donor will be contacted to donate at a specialized hospital. If you want to save a life, contact 0112 369 968 and register yourself as a stem cell donor.